While losing weight is difficult for many people, it's even more challenging to keep the weight off. 42% of Americans reported gaining an average of 29 pounds during the pandemic. But pre-COVID studies are a reminder that too many of us were already losing and regaining. So surgeon Dr. Vafa Shayani is here to offer some hope for those trying to lose weight and keep it off. So we're excited to have you, doctor. But we hear a lot about healthy weight range, right? But for those who don't really know what that exactly is or entails, can you explain?
Of course, that's a great question. So as healthcare providers, we tend to use an index known as body mass index, or BMI, which is a relationship between an individual's weight and their height. A healthy BMI for most of us is a number somewhere between 20 and 25. Once that number starts reaching 27, a person might be referred to as overweight, and numbers over 30 define obesity, and numbers over 35 are referred to as morbid obesity. Now, the reason we started using the phrase morbid obesity is right around that BMI, or body mass index, of 35 is when we start seeing patients struggle with health issues related to their weight. And when I say health issues, I'm referring to things like diabetes, hypertension, sleep apnea, arthritis, and many other health issues. And it is around that time that patients should start speaking with their doctors about their options for weight loss.
And a lot of people who have been dieting, throughout their lifetime. I mean, I have an aunt who's tried almost everything, right? But she's done that yo-yo effect. And why is that so harmful? We hear that a lot, that it's not good for you, right?
Absolutely. Our bodies were not designed to go through this yo-yo weight going up and down. Typically what happens is when we go on a diet, there's a sense of excitement and motivation at the beginning, and that leads us to follow what the diet wants us to do and helps us lose a few pounds at the beginning. But unfortunately, as time goes by, there's compliance fatigue that sets in. We start having a hard time sticking with what that diet expects us to do. And as a result, the weight not only comes back, most of us will experience even additional weight. And that yo-yoing of weight going up and going down is not very healthy for our body and for our organ systems. Instead, we expect patients to look for alternatives that allow them to lose the weight and keep the weight off. And it's that yo-yo dieting that usually leads patients to look into possible options like surgical intervention.
That was going to be my next question. When do we know that that's something we should be considering?
Sure. So we expect patients to at least try the simple task of exercising and maybe even using some diet pills at the beginning. Those things might work for a person who has about 10, 15, or 20 pounds to lose. Once a patient starts needing about 50 pounds or more to lose, losing the weight with diet and exercise and diet pills becomes very difficult. It is about that time when patients have the option of surgical intervention. And one such option is the lap band system for weight loss. Lap band system is a safe and very effective method of weight loss that uses a device that helps patients with portion control and elimination of hunger at the same time. The device has been around worldwide since 1992, and in the United States, it's been implanted since 2001. Hundreds and thousands of patients have had the lap band system put in, and those who've had it, they have managed to maintain their lost weight of up to 60% over a long period of time. The operation is done typically as outpatient. The patients are able to recover in the comfort of their home on the same day of surgery. It is an adjustable device that allows us to tailor the effect of the operation to the needs of individuals. And it's an easily reversible operation in case that ever becomes necessary.
Yeah, and it was really interesting too to see the illustration there of kind of how it all works. If we want to learn a little bit more information though, where can we go?
The best place to start is to go on lapband.com to get some facts about the operation and to learn whether or not lap band surgery is an appropriate option for you. Lapband.com.
Wonderful. Thank you so much, doctor. And if you'd like to see this segment again, you can head to our website as well, firstcoastliving.net.